Hey guys, it's Dr. Green here. I've had a lot of patients asking me about ALCAT testing. I'm going to talk about why I don't use the ALCAT test. Now, the ALCAT test is a food sensitivity test. I've had patients that I've run Cyrex testing, which are antibody tests, and we've said, hey, do you have a gluten sensitivity? You've got all these sensitivities. But then other people we've done, and they come in with this ALCAT test, and they're like, hey, I'm sensitive to broccoli, I'm sensitive to cauliflower, I'm sensitive to, salmon, all these other things. What's going on? The ALCAT test is a separate type of test compared to the antibody panels that I use in my office. Many patients, again, have them run and they just don't understand it's not checking antibodies. So what's happening is, again, white blood cells are exposed to various foods and substances. The reaction of the white blood cells is what they're looking at. Swelling, granulation, tissue death, that's what's observed. Adverse white blood cell reactions occur for many different reasons. The test process doesn't indicate why the response occurred or if it's autoimmune. It's only believed by some to indicate that there's an adverse reaction. It does not rule out other types of reactions at all, like antibody formation or processes that science has not yet discovered. So many doctors who run the ALCAT test will give the results to the patient and say, well, try to limit your intake. Well, gosh, if it shows up that it's reacting, shouldn't that be a don't eat? The reason they don't tell the patients not to eat is because it's not telling you there's an antibody reaction. This test is controversial. Many professionals believe it's not scientifically reliable and will simply show positive for foods eaten frequently. Many patients claim the results help them pinpoint problem foods, but not necessarily gauge the severity of the reaction. Here's a simple analogy to explain the difference between the ALCAT test, traditional blood or stool tests for IgM, IgG, and IgA antibodies. To look for antibodies in the IgA, IgG, and IgM systems, like Cyrex Laboratories or Interolab, it's similar to calling in the Army, Navy, and Air Force to find a criminal. The ALCAT method is likened to calling in the National Guard. It's claimed to be in another place to look for proof of adverse response. It's just not the same though. As with antibody tests, a positive ALCAT test is thought to be proof of a problem, but a negative test does not guarantee the substance is safe, since other body systems may react. And panels range from 50 items tested to over 200. Prices can go from the 80s to over $1,000. If you're interested in learning more, I encourage you to call and schedule either an in-office consult or distance medicine consultation with me, Dr. Green, to see if we can help with your chronic health problems. My office number is 704-987-3993, and our website is www.drakibagreen.com. Thank you.